Hi, hello, welcome back to our channel. So today we are going to see about the muscles of tongue. So it is going to be anatomical session where we are going to see about where the muscles origin and where it is attached and what is the use of the muscle and what is the nerve supply of it. So come, let's go into the topic today. So before going into the video, if you like the video, please do like the video, and if you have not subscribed our channel still, do subscribe. So come, let's go into the video today. So development of tongue, we have already discussed about the development of tongue. So the link is given in the description. You can check the development of tongue. And today we are going to see about the muscles and their attachments. So the muscles are like of two types. So one is the intrinsic muscles and the other one is the extrinsic muscles. We all know the extrinsic muscles are genioglossus, hyoglossus, and the palatoglossus and styloglossus. So these are the four extrinsic muscles, and we have four intrinsic muscles. So the intrinsic muscles are superior longitudinal, inferior longitudinal, and verticalis, and the transverse. So these are the four intrinsic muscles. First, let's see about the extrinsic muscles, like their origin. When it comes to extrinsic muscles, they are like we already know, right? The genioglossus or the hyoglossus or the styloglossus or the palatoglossus, as the name suggests, it is the origin and the attachment is described. So the genioglossus starts from the tubercles to the glossus, that is the tongue, and when it comes to palatoglossus, it's origin from the palate and attached to the tongue. And similarly, when it comes to hyoglossus, it starts from the hyoid bone and it attaches to the tongue. And when it comes to styloglossus, it starts from the styloid process and attaches to the tongue. So the origin and attachment when it comes to extrinsic muscles, it is very easy to remember. And when it comes to intrinsic muscles, the origin and the insertion is within the tongue. Functions of the muscles, the genioglossus is the biggest muscle when compared to the other muscles of the tongue. So it is like fan shaped muscle, and it has three portions doing three different jobs. So the upper portion of the genioglossus is used for the retraction of the tip, and when it comes to the middle portion, it is used for the depression of the tongue, and when it comes to the lower portion of the genioglossus, it helps in the protrusion of the tongue. So when it comes to hyoglossus, it is used for the depression of the tongue and makes the convex portion of the dorsum of the tongue, and it also helps in the retraction of the protruded tongue. So basically, the palatoglossus pulls the tongue from its roots upwards. When it comes to styloglossus, it helps in the pulling of the tongue upwards and backwards, so that it helps in the swallowing of the food. So when it comes to the movements of the intrinsic muscles, the superior longitudinal helps in shortening of the tongue and makes the dorsum concave. So when it comes to inferior longitudinal muscle, it helps in shortening of the tongue and making the tongue convex. Verticalis muscle helps in the broadening and flattening of the tongue, and when it comes to transverse muscle, it helps in the narrowing and lengthening of the tongue. So when it comes to the nerve supply, we have like sensory nerve supply, motor nerve supply, and the nerve supply for the taste. So we have three different types of nerve supply for the tongue, and where the sensory nerve supply for the tongue is in anterior 2/3 of the tongue is from the lingual nerve, and the posterior 1/3 is from the glossopharyngeal nerve. And when it comes to motor nerve, we have hypoglossal nerve, which is supplying all the muscles except the palatoglossal muscle, because the palatoglossal muscle is supplied by the cranial branch of the accessory nerve. When it comes to taste, similar to the sensory nerve supply, we have the anterior 2/3 of the tongue is supplied by the chorda tympani nerve, and the posterior 1/3 is supplied by the glossopharyngeal nerve for the taste, and the posterior most part of the tongue is supplied by the vagus nerve. So if you like this video, please do like, share and subscribe to this channel, and much more videos are waiting for you.